Good morning, class. My name is Alik. I'm going to be your PALS instructor today. How are you doing today?
I'm well, thank you.
Good. What's your name and why do you need PALS?
My name is Sam, and I just got a new job on a pediatric unit.
That's awesome.
In the hospital, so I'm going to need PALS for that.
Great. Well, this course is going to teach you a lot and hopefully prepares you to do well in your profession.
Great.
Our class is going to consist of a few videos. I'm going to teach some content. We're going to do some hands-on skills and run a mock coding. At the end of the class, we're going to have an exam. You need an 84% or higher to pass, okay?
Okay.
All right. We're going to start pretty soon. Any questions or anything?
Not at this time.
All right, let's begin.
Okay.
Let's talk about the approachment to a pediatric emergency. First thing you want to do is verifying that the scene is safe. We don't want the issue causing the pediatric patient problems to happen to you as well, okay?
Mm-hmm.
So just going to check and make sure everything's okay and you approach them in a calm manner. Next, you check for responsiveness. This is a shout, a tap. Oftentimes with infants, you can hit the bottom of their heel or shake them. You want to do it with a decent amount of force, not to hurt the person, but to elicit a response. If you get nothing, you go get help, okay? You yell, you shout for somebody to come in, help. I need some help. Also ask them to contact EMS and grab an AED. Next, you want to assess that victim for a pulse and breathing. We're going to do this simultaneously. We can look for chest rise and fall. We can check for breathing, as well as with an infant, we're going to check for a brachial pulse. That's going to be right in the middle between the shoulder and the elbow. Perfect, just like that. If we feel no pulse, we're going to begin CPR. Okay? So the victim's unresponsive and has no pulse, start CPR immediately.
Okay.
All right, and the way we start CPR is with high quality chest compressions. We're going to watch a short video just so all the stuff clicks and goes together, okay? So you can see it. All right, let's start the video.
Is to verify scene safety. Then tap and shout to check for responsiveness.
Mm-hmm.
Hey, are you okay?
Are you okay?
If there is no response, you should shout for nearby help or activate the emergency response system in your workplace.
Activate the emergency response and get an AED.
Check for a carotid pulse. Locate the child's trachea by using 2 or 3 fingers, and then slide your fingers into the groove just to one side of the trachea where you can feel the carotid pulse.
Mm-hmm.
The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you, the rescuer.
Mm-hmm.
Check for breathing by scanning the child's chest, looking for chest rise and fall. You can scan for breathing and check a pulse simultaneously to minimize time before the first compression. The check for breathing and a pulse should take at least 5, but no more than 10 seconds.
No more than 10
If
seconds,
you
very
observe
important.
no breathing or only gasping, and you do not feel a pulse within 10 seconds, start CPR immediately. A bit later in this course, we'll talk about
Okay.
what to do
We'll stop
if
the
someone
video
is
now.
unresponsive, is not breathing.
All right, next we're going to talk about compressions. This is by far the most important part of CPR, so we want to make sure we're doing high quality chest compressions, okay? So I'm going to show you the technique that I'm going to have you perform it right after, all right? A lot of hands-on practice here. So we're going to practice the two thumb encircling technique.
Okay.
You want to grip the baby, hold him like a baby taco. Take both of your thumbs, put them in the center of his chest, on the lower half of the breastbone. You don't want to go too low to press on that xiphoid process area. Very unstable inside of a baby. You just want to go right a little bit below the nipple line. So get your 2 thumbs together, put the baby face up on a flat, firm surface, and begin to push hard, push fast, and push deep. With a depth of about 1/3 of the victim's chest. You want to make sure you allow them for adequate recoil between each compression, okay?
Okay.
All right, we're going to have you try.
Okay. So, baby taco. And like this.
Okay, almost. So you got to put your thumbs together in the center of the chest. You want the,
together.
yes, you don't want one up and one on the bottom.
Okay.
And they're both in the same, general same area.
So like that.
That's excellent. Good pace, good pace. All right. Good job. You're allowing for recoil and everything.
Thank you.
Yes, great job. All right. You made it to the end. You've done well with the mega code. Your skills are great. We went over all the content. Now we just have to pass this test. Remember, we need an 84%, okay?
Okay.
But you got this. I'm going to give you this. You let me know when you finish.
Okay. Okay, all done.
All done?
Mm-hmm.
All right, let me look it over. Good, 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 good. This one right here. So, for number 17, you said signs and symptoms of an upper airway obstruction is wheezing, expiratory wheezing. That is incorrect. That's signs of a lower airway obstruction. That affects the bronchioles. Upper airway is going to be signs and symptoms are going to be more stridor and retractions on inspiration. Okay.
Okay, that makes more sense.
Absolutely. Yes, yes, yes. Otherwise, you've done great. Good job.
Thank you.
All right.